Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi and good day to all participants of the ITTP COVID-19 conference. My name is Anita Abd Rahman, and on behalf of my team, I will be presenting a topic on reimagining the public health strategy in prevention and control of COVID-19 management, looking at its evolution. This is the abstract of the topic. I'll start with a little bit of introduction about the topic, as well as explaining the evolution of the public health strategies with the different wave. Thereafter, giving an overall illustration and conclusion, as well as sharing the overall references. As all of us are aware, this novel SARS-CoV-2 or COVID-19 infection has passed its first year of pandemicity, where it started way back in 2019 in Wuhan City, China. And as of July 2021, the current outbreak has affected 222 countries with nearly 200 million of confirmed positive cases with a mortality rate of 2%. Now, dealing with pandemic has proven to be very challenging in the sense that we are dealing with a novel virus, and being novel, it has ongoing new development and updating in terms of its pathophysiology, clinical manifestation, and also medical management. And also because of the new variant that is existing in terms of the VOI and VOC, it has certain intrinsic factor, for example, being a super spreader, that is very much critical in the development of our public health strategy. Thus, this has put more demand on the current public health practices to achieve the best prevention and control management, as well as trying to manage the overall pandemic situation in Malaysia and the experiences that we had with the 3 pandemic waves. Now let us travel back in time and look at what happened in the first wave. Now the first wave that happened in Malaysia was reported on the 25th of January 2020, where the imported cases of visitors from China was the one that caused the first wave. Now, initially, the public health strategy that was implemented was very much straightforward and in line with the international health regulation recommendation for detection, assessment, reporting, and response. Now, having an outbreak, it automatically activated all state crisis preparedness and response center, or in short CPRC, as well as the district operational room. And at the same time, further tightening of the international border control, especially among entry from those initial affected country, which was China, was followed through with a proper surveillance system. Now, public health strategy cannot also function without the development of any standard or protocol or guideline, and therefore, Ministry of Health has come up with a guideline called Guidelines on COVID-19 Management in Malaysia that defines and specifies what needs to be done based on case definition, contact tracing, screening, diagnostic, as well as its clinical management. As of January 2020, there were 28 referral hospitals identified within Ministry of Health throughout the country that was capable of managing COVID-19 positive and suspected cases. As this particular virus at that particular time was a novel virus, public health intervention also included in giving basic health promotion aspect for population in terms of droplet transmission. And in the first wave, a total of 22 confirmed cases, with 90% of them were imported cases. Now, all 22 cases received hospital care and recovered with no fatalities. And the first wave was thought to end on 15 February 2020. After the first wave, Malaysia had a short-lived of no new cases for 11 days. Unfortunately, on the 27th of February 2020, new cases started to arise, and epidemiologically it was linked to a religious mass gathering that was held in end of February in the central part of Malaysia. The attendance for this mass gathering was estimated to be as big as 16,000 people, with approximately 1,500 of them coming from other Southeast Asia countries. Because the daily cases has already reached more than 100 cases per day, the government has opted for a nationwide total lockdown or movement control order that started in 18 March 2020. And based on this, all cease operation was executed. And as time goes by, the number of cases through mass screening was able to be reduced. This has also led to the country to go into conditional MCO and also recovery MCO as an exit plan. These are the public health strategy that was implemented in the second wave, which were find, trace, and test in terms of doing mass screening and also increasing laboratory capabilities. The second was establishing a low-risk quarantine center able to cater for category 1 and 2 COVID-19 patients. And this saw the biggest multi-agency involvement that goes down history in providing comprehensive and management response during the pandemic. At the same time, Ministry of Health came up with updated 31 annexes of standard guidelines in proper documentation, as also procedures for definition of case, surveillance, and also in giving mental health psychospiritual support for healthcare workers and also patients. So from July to August, we saw declining of cases to less than 100 cases a day, and even single digit in a day. Therefore, some of the low quarantine centers were able to stand down and close temporarily. Unfortunately, again, in September 2020, Malaysia saw a sudden surge of COVID-19 cases where it originated from cluster from illegal detainees and also a state election that happened in the month of September. This contributed to more than 20,000 confirmed cases in only 2 months from September to November 2020, which was an equivalent to almost 40th increase fold. At the same time, because Malaysia was already into the recovery movement control order, allowed businesses to operate, and this has contributed to certain occupational and also community cluster. Now, because of the number of cases that arises, this has put more pressure to existing health system to almost maximum utilization, and to cater this, the government opted for another nationwide MCO in May 2021 based on the justification of the number of cases, the variant that existed, and also because of the weak compliance in some of the community. Additional to what is being practiced in the second wave, the third wave saw public health strategies in upgrading the national guideline of COVID-19 management, where a total of 51 updated annexes being developed. To cater for such capacity, Ministry of Health Malaysia established a COVID-19 assessment center, which was found throughout the country to classify patient category with a subsequent patient management care, whether they are suitable for hospital, low quarantine, or home quarantine. In terms of bed capacity, the expansion in the number of low quarantine centers was able to come up with at least 37,000 bed capacity. And for testing, more of a laboratory facility was approved as being capable to do diagnostic and also screening tests. At the same time, because of the cases, the majority of cases that occurred originate from Klang Valley, a special task force was developed to be responsible to execute all the action plan that is needed for the specific region. This slide offers an overall illustration of what has been explained earlier in trying to concise what are the public health strategy that was used in the first wave, second wave, and also third wave. And based on the components of controls, common SOP, laboratory testing, quarantine facilities, guidelines. Now, I would like to draw attention to, last but not least, one of the crucial public health strategies, which is vaccination program. Now, this program only occurred in the third wave, where it started at the end of February 2021, and till the end of July, we have about 17.5% of total Malaysian population being fully vaccinated. Having shared with you what were and are the public health strategy that was implemented in handling COVID-19 pandemic in Malaysia, we would like to pose a question. Have we won the battle? Now, unfortunately for Malaysia and probably in some other countries, uh, uh, the result that we are seeing right now does not show any sign that it will end soon. Therefore, in terms of public health strategy, it needs to be dynamic and flexible in the sense that we are dealing with a novel virus, and perhaps this is the first pandemic in many of our healthcare professionals in their lifetime. So the lesson learned is that the constant challenge in handling COVID-19 pandemic needs to be based on evidence-based as the infection evolves, and therefore when the disease evolves, public health strategy needs to evolve also. Lastly, uh, we as public health care professional needs to be vigilant, always be prepared, and also need to be strong. These are the references that was used for this presentation. With that, thank you for listening.